Hi, I'm Julie Ramirez. I'm the Executive Director of Lee County Medical Society, the one who's been texting you today. To my left is Dr. Justin Casey, ear, nose, and throat specialist here in Southwest Florida. To my other side is Dr. Stu Bobman, longtime radiologist here also in Lee County.
How are you tonight?
Great, thanks. How are you?
Thanks for joining us.
Absolutely. Thank you so much for having me.
First and foremost, I think we just wanted to give you an opportunity to chat a bit about yourself and your platform and let us get to know you.
Oh, well, wonderful. Well, thank you so much. My name is Vanessa Oliver. I am the current state representative for District 76, which is half of Charlotte County, North Fort Myers, the northern part of Cape Coral, as well as Babcock Ranch and all of DeSoto County. So I was first elected in 2024, but prior to that, I grew up in Charlotte County. I left to go to undergrad and then law school, and came back in 2012 with my husband, who's also an attorney, to raise our family. I work for my family's company, which is Ambutrans Ambulance. I'm also board certified in health law. I got that certification in, I think, 2019, which was one of the hardest things I've ever done, but very worthwhile. Yeah, so it's wonderful. I've served countywide for the Charlotte County Airport Authority, but have really loved getting to be a state representative for our area.
Awesome. Awesome. Very good. And Ambitrans, what is that?
So it's Southwest Florida's largest private ambulance service. So we do
Oh, nice.
primarily interfacility transports. So from freestanding emergency departments to the hospitals, or from hospitals to skilled nursing.
Nice. Are you like the in-house counsel for them then with your law background?
Yeah, so I started as in-house counsel, and then once Medicaid managed care came around, I was put in charge of the billing department to manage that whole transition and process. And then in 2020, I believe, or 2021, my dad stepped back a little bit and I became CEO.
Awesome. Very cool.
Thanks.
So one of the questions we put together some questions, and I think the one that we're going to start with that we're going to ask you tonight is relates to access to care. If you don't mind chatting with us a bit about that. And usually when we talk about access to care, it has to do with uninsured or underinsured
Mm-hmm.
Florida citizens, which of course deserves a lot of attention. But my question has more to do with an access to care issue that's becoming far more prevalent. It
Mm-hmm.
involves insurance companies kind of improperly wielding their power to control access to care.
Oh, sure.
As you may be familiar, this involves denying care, delaying care, a number of strategies they use, prior authorizations, clawbacks, just straight up denying integral care. So it's that on a daily basis, patients aren't able to get access to scans, procedures,
Mhm.
surgeries, medical equipment that their doctors deem is medically necessary.
Absolutely.
Even if it's not complete denial, the insurance companies know that the more roadblocks they put up, the more delays they put up, the more likely the patient's
Mhm.
going to give up and not go through with it. So, what are your thoughts on this? And then, if you remain in office, how would you affect this?
Yeah, so actually, I worked a little bit with the Florida Hospital Association last session, and Representative Hillary Cassell ran a bill that was going to sort of address some of the prior authorization problems that providers have been facing. And I'm not going to lie, it's something that I face in my business every day and have for quite some time. And we're seeing it
Yeah.
get worse and worse with the Medicare Advantage plans in particular, now requiring more and more prior authorizations for things that we would deem emergent,
Yeah.
and that should not, frankly, be requiring prior authorization in the first place, let alone denying it. So that is something that I am actually laser focused on, is making sure that patients who are paying for insurance are getting to actually use it and getting the services that are required, because otherwise you're forcing patients back in traditional Medicare And that's frankly what I've recommended to people who are actually sick is you're not going to be
Mm,
denied the services that you need if you're
right.
in traditional Medicare. Just get,
Right.
get a Part B plan and get a supplemental plan and stick with that.
Yeah.
But it's a huge problem. Insurance companies trying to butt in and take the place of physicians who have the clinical knowledge and understanding what's actually happening with the patient. So that is something that I am going to continue to work on because, again, every patient deserves to have the medical care that their provider deems that they need.
Absolutely. Awesome. Stu or Julie or anyone else, any other questions you guys have?
You in the seat that was Spencer Roach's?
Yes, sir.
Okay.
Yes, he called me up the morning that he decided that he was not gonna, or that he was about to announce that he was not seeking re-election, to ask me if I would had thought about running for his seat because he was going to announce. So we made a really quick decision. He endorsed me right away, and it's just been wonderful.
Well, I only have 2 more minutes, but do you want to close up real quick, letting know our physicians in our community how you're going to help them?
Oh, absolutely. One of the biggest bills that I passed this in my past 2 years was a pediatric readiness bill, and that was to require every single hospital emergency department in the state of Florida to be able to treat and stabilize pediatric patients. And I did that with a lot of help from the physicians who knew and who had been in emergency departments, and seen that they were not all deemed equal. They did not all necessarily have the same standards in place, the same equipment in place that was necessary. So I am absolutely committed to fighting alongside providers to ensure that we have better access to care and that our patients are seeing physicians, are getting to be treated by physicians, and work towards having the healthiest communities that we can.
Awesome.
Thanks
Well,
for
we truly
joining
appreciate your
us.
time. Thank you so much.
Oh, thank you all so much. I appreciate it.
Hi, David. Welcome to the Lee County Medical Society. I'm Julie Ramirez, the one been texting you. Beside me is Dr. Justin Casey, ear, nose, and throat specialist. And then next to me is Dr. Stu Bobman, our radiology specialist. So I'm going to let them ask the questions for you.
Hey, sir, thank you for joining us. We appreciate it.
Silverberg, and I'm a resident of Naples. My background is as a journalist. I was a journalist in Washington for over 30 years. And at that time, I covered mostly defense and the international defense trade. I covered Congress, and I wrote the book Congress for Dummies. And I also, which is a lobbying manual, basically. I also wrote a book called Masters of Disaster, which tried to derive the political and leadership lessons from America's greatest disasters. It looked back at the history of all of that. I was in Washington on 9/11 when Flight 77 hit. I actually heard it hit the Pentagon. And after that, I changed my focus to covering Homeland Security. So I covered the establishment of the Department of Homeland Security, establishment of ICE, as a matter of fact, and all the other attendant agencies. And then in 2013, I came down here to Florida. I had been a seasonal resident. We'd had a place since 2004 and expected to lead a very quiet, retired life. But I got involved. I started getting involved in local politics. I was a communications director for a congressional candidate in 2018. I did a blog called The Paradise Progressive. And then last year, when they established Alligator Alcatraz, that really galvanized me. I mean, as I watched them develop what they said was going to be an alternative immigration system for the state of Florida, and describing this kind of a facility, which was clearly, I believe, and I insist on calling it that, a concentration camp. That got me much more politically active. And I was recruited. I was suggested to run for the Florida State Senate, District 28. Kathleen Passidomo is stepping down. I don't know if you're aware that District 28 is all of Collier County, all of Hendry County, and then East Eastern Lee County. So Eastern Estero, Gateway, that whole area. RSW Airport is in that. My intention is to represent absolutely everybody in that district, and to do it fairly, and to basically do no harm to Florida and to undo some of the harm that I believe has been done. So I'll leave it at that, and I'm happy to answer your specific question.
Very good. Thank you so much. So the question we have for you tonight revolves around access to care. Usually when we talk about access to care, we're referring to, uninsured or underinsured Florida citizens. And that's, of course, a very important point. But tonight's access to care issue we want to ask you about involves more insurance companies improperly wielding their power to control access to care. Denying care, through or delaying care, prior authorizations, and they know that the more, even if it's not a complete denial, the more hoops they make patients and doctors jump through, the more likely the patient doesn't get the care, whether it's a scan, a procedure, a surgery, etc. Even when the doctors are deeming it medically necessary. What are your thoughts on this, and how would you address that if you were in office?
Well, I believe in care for everyone, and I don't think that there should be anything unnecessary, and the state should wield its power over the insurance companies fairly, but skeptically, I guess I'd put it. There shouldn't be unwarranted obstacles in the way of someone getting care that's necessary. And I guess the state role would be to oversee this and make sure that there's nothing that's being done harmfully, that's being done that harms people or blocks them from getting legitimate care. It's that simple.
Very good. Stu or anyone else have any questions?
Who's running against you?
Lauren Melo. She's a Florida House representative. She's had 3 terms, and she represents District 82, which is like Eastern Collier.
So I heard that in Naples they're starting a new residency program at one of the hospitals for special surgery or something.
Well, I'm not familiar with a specific residency program. I mean, that's outside the realm of government. So I can't speak to that specifically. Let me say that, and I put this in the form, I had an uncle who was a psychiatrist, very well respected, and we as a family almost went through his education, his internment, and then his residency, which was at Monmouth Medical Center in New Jersey. And then he set up practice ultimately in Miami, where he handled headaches and had a headache clinic. And so he passed away in 1999. He did some really pioneering work on the use of lithium in treatment of manic depressive disorder, and published on headaches. So I sort of vicariously went through a medical, I hesitate to say a medical education, but the ordeal of a medical education.
Yeah.
Saw what he had to go through, to become professionally certified, to get his residency, to get his credentials, and ultimately have a successful practice. And I have great sympathy for everybody who goes through that, because I know, speaking for myself, I don't think I could have passed organic chemistry.
Well, I don't think I could have written 2 books, so you got me there.
In your form, in your questionnaire, there were some really interesting questions that I felt strongly about. One was making sure that we have fully certified and educated and reputable medical practitioners, which is something I would absolutely insist on. If it came to me in the state Senate, if I had to deal with legislation dealing with that, I mean, this is just too important to let a non-practitioner or somebody who isn't fully credentialed practice. And then the other thing was about the departure of young physicians after they finish their residencies here, leaving the state and going elsewhere. And something that I'm very concerned about and really bothers me is that the state of Florida, its government, its legislature, its governor, have kind of made war on the demographic of families that are just starting out, when you're starting out, you're getting married, starting a family, building a practice, establishing a career, maybe sending young children to school. All those things seem to be under assault, especially public education. It just seems stacked against that demographic, and that is the most important demographic we have. And that includes young physicians, young healthcare workers, people who really want to establish themselves in Florida. They face a lot of obstacles that they simply should not have to face. And I want to do whatever I can to prevent that kind of pressure and those kinds of obstacles and impediments from affecting them, because this is the demographic that's the future of Florida. And frankly, our politics are so oriented towards the elderly and the wealthy and the retired, which is all well and good because I was among their number at one point. But I mean, that's not where the future lies, and we've got to build towards the future. Let me add something else, because here in Collier County, we had some extraordinary anti-vax, anti-science activism and sentiment, and I did whatever I could to stop that. And ultimately, I don't know if you're familiar with it, but Collier County passed they were presented with an ordinance that was really anti-public health, really was. Now, they watered that down to the point where it simply reiterated state law. We're in compliance with state law, no vaccine mandates, that kind of thing. But then they had a resolution that was absolutely anti-public. It was anti-public health. It wasn't a mere sentiment. I mean, they hated on the very idea of science being applied to a large number of people. And it was a legacy of the pandemic. And the anti-vax contingent here was extremely loud, if not large. That got watered down somewhat, but I did whatever I could to stop that kind of development. I did not succeed fully, but that's what I did.
Yeah, that's surprising to hear for Collier County, but yeah, very well said. Well put.
We thank you for joining us. And
thank you. If I can add one more thing in regard to that Collier County ordinance and what happened here. If you go to my blog, it's called The Paradise Progressive. It predates my candidacy. TheParadiseProgressive.com. And if you click on the link to Collier County, you will see all my coverage of Collier County. You'll see my coverage of that particular ordinance and resolution. You'll see what we were up against. In fact, you'll see the whole history of what went on here during the pandemic. It was really disturbing.
All right. Well, I appreciate you joining us.
Well, I thank you for the opportunity. I really appreciate it, and I enjoy. I hope we continue to interact and converse no matter what happens in the election.
Thank you, David. Appreciate it.
Yeah.
Thank you.
Awesome. Yes, I'm Cornelius Fowler, candidate for Florida House of Representatives District 77, which is pretty much out in East Lee County, Buckingham, Alva, Charleston Park, San Carlos Park, Lehigh Acres, Fort Myers Shores, that area. And I'm in this race because I want to bring true change to the people of Southwest Florida. I'm a hardworking guy. I'm a farm worker, father of 5, married for nearly 25 years now. And quite frankly, I'm really terrified of what the future may hold for the young adults that's coming up, or the young kids that's coming up in our communities, and them being able to afford to be able to branch out on their own. Like I said, as a father of 5, I have 2 that's in college right now, and it's extremely hard. And I just don't think that that our elected officials are paying attention to what is needed in our communities. I believe that not only should we be able to survive, but thrive in the communities that we live in. I'm a union guy. I belong to the IAM union for the last 18 years. I'm a part of the AFL-CIO executive board. I hold a bunch of different committee executive boards, and I go to Tallahassee about 2 times out of the year. I go to Washington about twice a year and sit in on sessions to really take in what's really, the process of them passing bills and really, paying attention to the bills that they're passing and how it affects everyday life. I know everybody know and understand that just the cost overall, the cost of living is just astronomical at this point. And, I just want to help bring change and keep people involved in the process. I don't think that we have enough say in what happens in Tallahassee or in Washington, D.C. And I want to bring that back to the table.
Awesome. Well, our question that we wanted to ask you tonight revolves more around access to care. And usually when we talk about access to care, we're referring to uninsured or underinsured, which of course are very, very important in the state of Florida. But tonight we more want to ask about the kind of the rising prevalence of insurance companies kind of wielding their power in improper ways to control access to care. This involves things like delaying care through a number of different strategies, like prior authorizations, street clawbacks, or straight up denying care that their doctors have deemed necessary, be it imaging, like CT scans and MRIs, surgeries, procedures. These sorts of things get denied all over the state and every single day. And doctors that spend a lot of time in their day doing prior authorizations that sometimes are meaningless. Um, uh, so, what are your thoughts on this topic? And if you get elected, how would you tackle it?
Well, healthcare is not a privilege, it's a right. People get sick, and we should have access to the healthcare that we need. Um, there should be guidelines against any insurance company that is, slowing down or preventing, people from, having access to healthcare. Healthcare in itself is gotten so expensive now. And I talk to people every day, including myself. It's very expensive for me to have a family, on insurance, and it shouldn't be like that. We should be able to work with our doctors in order to get the care that we need. And I'm willing to work with you all to bring forth those policies that will help make that process easier for our citizens here in Florida.
Well, you're my representative in my area in Lehigh Acres, and I know our community has grown significantly. And I know that physician shortage is a big deal, just trying to get an appointment for our kids. It took 4 months to get a specialist. What's your goals in being able to bring physicians, MDs and DOs here to Lee County and loving Lee County like we all do, and having them stay and be able to work here?
Yeah, well, we need to tap into our universities that we have here, FGCU and Southwest College, and bring forth programs that will allow more students to come in and be able to have jobs waiting for them. Southwest Florida is like the mecca for retirement. We have a lot of retirees here in Southwest Florida. So it's in our best interest to have enough physicians and caretakers here in Southwest Florida to be able to meet those demands. And whatever we can do to bring extra funding to help those students through school and to help businesses, doctors' offices in the hospital hire those students on. We need to work in that direction. We have to retain the students that we have that come into Southwest Florida. We shouldn't have to lose them to other areas. We should be able to keep them right here.
And
One of the issues we've had, retaining physicians in Florida over the years, it's gotten better, but still is an issue. Is some physicians fearing to practice here in Florida because it has not always been the friendliest state from a medical malpractice standpoint. What are your thoughts on that and on potential tort reform and those sorts of issues?
Well, I mean, we shouldn't tie stipulations on to physicians and stuff here in the state of Florida. We should make it easier for them to be able to treat patients, without having to be, targeted, in those type of areas that would, let's put a little damp down on some of that type of stuff so we can be able to produce the physicians that we need. And I'm willing to focus on any bills or any legislations that, you all want to put forward to help make that easier for physicians. That's my whole thing about, running for office, working directly with the working class people here in Southwest Florida, putting forth bills that they see that helps them out in the area that, that they work in or they, specialize in.
Great. Thank you
Awesome.
so much for joining us.
Thank you, Cornelius. Appreciate it.
I appreciate y'all having me. Thank you.
Yep.
Yes, sir. Have a good night.
You too.
Okay, so I'm representing District 78 as state representative, and that's what I'm going for. And I've lived in Southwest Florida since 1987. I've started several businesses, including Living Local, which was a magazine which many providers or several providers advertised in, with great results. And then I also built and established a medical practice 5 years ago. And my reason for running is for transparency and accountability in all of our systems everywhere. We don't have transparency and accountability. The systems that we do have in place, they don't function well. There's a lot of flaws in them. So that's why I'm running, and I'm running to listen to the people, because I feel like a lot of solutions come from the people. It's not just me or whoever gets elected to go up to Tallahassee to speak or to present, but it's the people that give us the ideas to bring up there. It's not just us.
Absolutely. Tell us a little more about the medical practice that you worked with.
I built
ran.
I built Ameglio Orthopedics, which it's still running. It was successful when I left, and I built it from the ground up. I don't have a college degree, and I built it from the ground up. It was quite the experience. I got it to a near paperless state, HIPAA compliant. And I believe I was one of the first in the area to hire Filipino remote workers. And they were all HIPAA compliant, and they were great because, as you know, insurance authorizations are a nightmare. I lived it, I breathed it. And it's very cumbersome in the office when you're sitting on the phone for an authorization and you can't assist another patient because you're on the phone. And so I found them to be extremely helpful and useful. They helped with charting. And so it was fun navigating that. It really was, to come up with that solution and train them and get them set up. And they had remote stations, actually. You could see them on the computer. I could see what they were doing, actually. And if they had an issue, they would just speak up. And then I'd put my headphone and talk to them, and they could actually print from their location in the Philippines. It was all set up remote. So they could actually check in a patient. I had them checking in patients. I had an iPad in the front. And some people would say, "Is that person real?" And I'd say, "Yep, they're real." And they were great. They were great. But I understand the headaches obviously, I don't know all of them because I'm not a physician, but I saw them and I lived the insurance authorizations, the decreasing reimbursements, the just everything, and there's a rush to see patients. It's very hard when you have a certain amount of time with a patient because you're thinking, "Oh my gosh, and my own reimbursement's only going to be this much money. I have to keep up." And I think that happens a lot, especially in primary care, because the reimbursements are just incredibly low, and there's no surgical procedures or surgical centers that you can make extra profits on. So yeah. So I definitely have a respect for the medical field. I certainly
Awesome.
do. Yes.
Well, we appreciate that. And then, yeah, you you sort of stole my thunder a bit there with my question, but I want to ask it anyway. That my question tonight revolves around access to care, not just the typical access to care discussion, which is uninsured or underinsured, but more insurance companies limiting access to care. You mentioned prior
Yes.
authorizations, denying care. They know the more hoops that they make patients jump through, the more roadblocks, the more likely patients don't get that care, and the insurance reaps the benefits of the insurance company reaps the benefits of that. You know, speak a little more about how specifically maybe you'd address that if you were elected.
That is a huge issue. And that's something that I would love feedback from the medical field. I definitely feel like the processes are very antiquated. When I started the practice, I could not believe how antiquated it was, that you had to hold on the phone line, you had to do this, you had to do that. I'm sorry, we can't use Max. Nope, I'm setting up Max in here. I'm going to make it work with Max. So, my ideas right now is I want to get feedback from providers. I want to get feedback because I don't know every single struggle. I'm familiar and I understand the frustration, but I certainly don't hold all of the solutions. But I do know that access to care is huge. People come in, oh, sorry, we didn't get the approval. We have to go back to the primary care doctor, and then you can't see them. Or the morning of surgery, you get something come in, oh, sorry, it's not approved, and the person's
Yeah.
about to go under anesthesia to have their medical procedure. So, I don't know how to, it's a monstrous problem. It's not just, okay, we're going to do this and the problem's solved. Like I said, I really think comes down to our systems right now that are, they're antiquated, they're not reliable. I said this in an interview the other day. They were saying, what do you mean they're not accountable and they're not working right? Well, we have 30,000 students we can't find the vouchers for that are in the voucher school system. They're just somewhere. They don't know where it is, and it equates to $240 million. That's missing, just missing. So we need to go through, hey, where's that missing? Where did that come from? And if that's just one little portion of our budget and the money, then imagine how many more there are. So we have to fix those underlying systems. It's like starting from the ground up. So we have reliable systems that we can count on.
Very good. I agree. Anyone else have any questions right now for Audrey?
I guess I'll ask my question again.
Okay.
Just in regards, you've been here a long time and you know our physicians in our community, and you know that our population is growing way faster than our physician population. What are your thoughts about making sure that we have MDs and DOs as physicians coming to South Florida and staying in South Florida?
Well, I think we need to look, and I'm not familiar with this, what residency programs we have available and increasing those residency programs and bringing in those providers that we have a lack of, which I'm sure primary care, I know mental health is a huge issue right now. I'm not really quite sure about your specialties, but I think it's important to have those opportunities for residency programs. Yes. So I'm for getting doctors in here. They can, because you call and you try to get an appointment and you can't get in, for months and months and months. And that's a problem, especially if someone has a critical illness and something that's undiagnosed. I know last year I had a lump and I wasn't able to get in for several months. And that's scary, especially if you have I have a history. So that was scary. So we definitely need to have healthcare accessible.
Thank you so much for joining us. Just even if it's just it's nice to see your face and be able to talk to you personally. And we wish you the best of luck in your race.
Well, I appreciate the opportunity. This was a great idea. So thanks so much for including me. I appreciate it.
Thanks for joining.
Thank you for attending. Have a good night.
Have a great one. Thanks again.
Bye-bye.
Details.
Maybe a Zoom call without one of those,
Yeah, never done that before. Adam Botana is the Republican candidate, and I'm the Democratic candidate. Neither one of us are in the primary, which is on the 18th of this month. So we're both running unopposed. It's District 80, and District 80 essentially is all of Bonita Springs, all of Estero, and the 5 islands, except only the bottom half of Boca Grande. Okay, so I got Pine Island, Sanibel, Captiva, Fort Myers, and Hickory Island, so which is part of Fort Myers Beach. So that's my district. It's been obviously, as you know, redistricted twice. It was originally just Lee County, and then it started taking on the shape of an amoeba, and now I'm not even sure it looks like an amoeba, but it's sort of an odd looking thing. So anyway, that's my background. Not my background, but that's my position right now. So anyway, I'm from Detroit, Michigan originally. I started off in teaching, and I was involved in the Archdiocese of Detroit for about 5 years. I was an assistant superintendent there for 5 years, running the Peaceful Integration Project, which was a parallel event to what was going on in the public schools called desegregation. Then I moved into healthcare a few years later and ended up spending about 12 years with Henry Ford Hospital as the Vice President of Organization Development. And then subsequently did about the same amount of work time with Beaumont Hospital, which is now Corewell, which is a merged hospital system in the Detroit area. And then I went on for probably the next 40 years or so, spending time primarily as an external consultant to a number of organizations, Stanford Health up in California, Mount Sinai for about 12 years, Baptist Hospital, Miami, Tampa General for about 5 or 6 years. Most of the time working with people in the C-suite. And that, of course, included the CNOs and the CMOs and board members and so forth. And my job primarily was to do team building, leadership development, and help them do assessments of their organization, primarily at the top of the organization, and then build engagement plans for the rest of the staff, management, supervision, and so forth. So that's kind of my background in healthcare. I also, as of last month, I was looking at, I looked at my calendar, and that I started teaching with ACHE, which is the American College of Healthcare Executives, back in 1986. That's probably before most of you were born. So, but in any case, what I taught is I taught the first soft course for ACHE called Team Building. Back in the day, all they were doing was teaching courses on finance and construction. So things have changed dramatically. And I taught team building, leadership development. In the last 7 years, I taught the power and politics in healthcare organizations, how to build trust and trustworthiness. So that was one of the motivations, because the work that I did was probably an inclination for why did I do this. And at my retirement age, so to speak, I wanted to leave a legacy, and I just got involved with politics kind of on a local level, nothing real serious. And then this came up, and I said no twice, and then I said yes 3 times. So the third time I said yes, I jumped into the barrel, so to speak. And so this is my first quote rodeo, so to speak. So that's a little bit of my background. I was born in the Detroit area. My background is I'm Ukrainian, born in America, though born in Detroit. My dad was born in Ukraine. My grandparents were also, my mother in Saskatchewan, which is actually considered a mini Ukrainian community, so to speak. So that's a little bit of me. And the reason I'm running is for a couple of reasons. That was one of your questions, and it's primarily to get more invested in the affordability for my district. My district median age is 63.6. It's the oldest district in Florida, median age. The closest is 49.9, and that is District 79. We're in the top 5 in terms of household income. But also, interestingly enough, is 13% of the people of the 186,000 are at or below poverty level. So it's kind of an odd look. It's not a bell-shaped curve. It's sort of an odd looking configuration. So it's a fascinating and a challenging district to be working in. So that's one of the reasons I wanted to get involved, is because I was listening to a lot of my colleagues. And what I'm hearing was a lot about affordability. I was hearing a lot about insurance reform. I was hearing a lot about development and why there was no control over development. And what we know is the state pretty much has controlled the development, but I think what people have is an opportunity for a voice, and that is to give them a voice so that they can get actively involved, like I am with Engage Estero, so that they can have some, measure of control over zoning and some of the other aspects that they can put their arms around. So that's one of my motivations. I guess I should go through all these questions, right? I wrote them down. You want me to?
Dr. Casey has a question for you, and we only have a couple.
I think we'll take those in submission to review. For sure, we appreciate you filling those out. But the question we have for you today revolves around access to care.
Right.
Typically when we have this discussion, we're referring to, as I'm sure you're familiar, uninsured or underinsured. But today, I specifically want to ask more about insurance companies controlling access to care for insured patients. As I'm sure you've seen a lot in your career, prior authorizations, denials, hoops to jump through, roadblocks to put up for doctors and patients to slow down care, deny care, and ultimately put more money in the insurance company's pockets. So, briefly let me know your thoughts on all this and how you'd address it if you were elected.
Yeah, I looked at your questions that you have too, and I think some of them are overlapping, and I think that's how I would address it. I think the prior authorization is one that, kind of surfaces quite a bit. I did some work locally with, Tampa and also with Lee Health over the years, and also NCH. And, that's kind of been an issue in there too, along with, physician extenders. And I think they're separated, but they overlap. But in terms of prior authorizations, that's a real issue. I mean, we hear about it in the media all the time, and there's always someone like, CBS, NBC jumping in and be able to access the insurer and also the patient and get some resolution. That's an awful way to run a system, is have to wait for it to become part of the television entity, if you will. But I think what happens with prior authorization is there's issues with, the insurance companies, first of all, should not be making medical decisions behind a computer. I mean, it really has to be in the ownership of the physician and, of course, the patient, and, of course, as a supportive is the hospital or the entity that you're working with, clinic, etc. I think that's a real critical thing. And to me, that's why one of the reasons I'm running is people seem to feel like they don't have any control over anything, especially patients. They feel they don't have control over who they can access. A lot of patients are losing their primary care folks. They don't have the specialists that they want, etc., that they feel that they need, like rheumatologists and so forth. And I think it's real critical that we look at not only prior authorization and making sure that physicians have total control over that. The patient is primary. The patient's number one. The physician actually is number two in the process, but the patient focus has to be number one. That's the vision. The physician has to be the agent, if you will, of making this occur, because patients have no interest, nor do they have the education or the wherewithal to deal with the insurance companies. I mean, they're just clogs in the wheel, and it's real critical that the physician becomes more active, whether that's through associations or whether it's a one-on-one with the insurers and so forth. Where the state comes in, and this, I really believe this, and a lot of people don't back me on this, but the state has a primary responsibility for the welfare of its citizens. And the primary welfare for the citizens of Florida, being it's a highly retirement-aged community, is it has a primary responsibility to be engaged in that. And not to the extent that they're taking everything that the U.S. government brings into play, but they really have to take a stand through a foundation, if you will, and establishing working mechanism, working structures. Right now, there's no structure. There's these stovepipes. There's the physician groups. There's the insurance groups. There's the state groups, and they're like stovepipes, and they're working vertically rather than horizontally with each other. And I think what's really necessary, I'm a big believer in structure, because without structure, you have chaos. And within structure, you can have some freedom within that structure. It's not going to compromise you, but it's going to enable you because everybody's working within the same play field. And that's why I think that's a really important piece. Now, that may seem pretty general. Do I have the specifics about how to work with the insurance companies? No. Will I be able to access people that can? I believe I can. I mean, that's one of the things I'm pretty good at is working relationships and building relationships and going to the people who have the answers, because I don't have them all. I don't have all the answers. So I know it's a long way of trying to answer that question, but I think access to physicians is a really critical piece here also. And that is, I think what we need here in Florida is we need a system where the state comes into play along with the hospitals, the for-profits and the not-for-profits, and we need to build medical, if you will, medical training facilities, because you need physicians. We can't just wish physicians to come into play, but we have to be able to encourage them to come into play. And one is to set up a medical educational process. But also the key thing is to incentivize the physicians who are trained here to stay here. In other words, if you're going to, and that may require getting some grants. Maybe there's a percentage grant of paying for some of the quote tuition, if you will, for the physician to go through the process of the education. And let's say it's 10% or 20% or 30% of it. I think the state can require that for that X percent, you have to spend X number of years in the state of Florida. I don't think there's anything wrong with that. It's worked before. It's worked historically. It's worked with physicians. I worked with 15 Indian Health Service clinics across the country over the past 40-some years with the Navajos and Menominees and so forth. And they were fortunate because they were going through what was called a self-determination 638, where the federal government turned over the care of the patients and the hospitals to the actual tribe itself. Now, the important thing, though, is they were recruiting physicians that were trained elsewhere by providing them with an incentive to be with them for 3 years, 2 years, whatever the case might be, and actually work in their clinics. And the good news was 80% of them stayed beyond whatever that requirement was, whether it was 1 or 2 or 3 years, because they got to become embraced within the community itself. So I think we could do that in Florida.
Thank you, Bill. Appreciate it.
Thank you.
Thank you so much. Have a good night.
Thank you.
Well, hi everyone. I have to say this is the first of these interviews that I see familiar faces, so it's nice to see you guys. My name is Susan Frantz. I'm running for State House District 78. That's the seat formerly occupied by Jenna Persons-Mullica, our now Supervisor of Elections. I'm running for this seat. Do you want me to talk about my stump speech or anything like that?
Yeah.
Okay. So I'm running for this seat. Just like you guys, my family came to this community for opportunity, the opportunity to live in an incredible place, raise a family in a safe community, get your children a great education, and scale a medical practice in a business-friendly environment where there's opportunity to continue to scale and grow. And as I've grown up in this community, I've felt that same support as a small business owner myself. I own a marketing agency. And when the seat vacated, so throughout my career, I've had the opportunity to help multiple campaigns, marketing wise, and I started to learn more about the process. and get invested with the process. And I felt like this is not only something that I feel called to do, but something I know that I could do really, really well. And so when the seat vacated, I ran for it. And so here we are today. I love this community and I look forward to stewarding it forward in Tallahassee. And I truly don't trust anybody else to do that but me. And so that is my little spiel.
I like that. I like that. Very good. Very good. A question we have for you revolves around access to care. The typical access to care discussion revolves around uninsured or underinsured Florida citizens, which is a very important topic. Today, specifically want to ask about insurance companies limiting or blocking access to care, prior authorizations, denials, delaying care, whether it's imaging, surgeries, procedures, medical devices. This happens every day, resulting in, a lack of access for insured patients to care and an inordinate amount of time for physicians and their staff with prior authorizations and extra paperwork. So, what are your thoughts on this? I'm sure you have some, based on your dad's practice, and then, how would you affect a change on that if you're elected?
Sure. So I think that we have moved into an insurance-centered system, and we need to move back to being more of a patient-centered system that gives transparency to patients so that they understand what is going on, what provide, and gives transparency to the providers too, so that they're not delaying or inhibiting medically necessary care that patients need.
Awesome. Um, any more thoughts on how you would do that at the state level?
So I think that at the state level, allowing creating policy around like exactly transparency and what the processes are. I know at the federal level, they're working on creating some policy around understanding where our drug prices and our insurance premiums are coming from, bringing that down to the state level so that we can see where our efficiencies are and try and streamline that process a little bit so that you guys can care for the patients and that insurance companies can kind of just stop doing what they're doing.
Yeah, awesome. How about scope of practice? And there's a number of medical specialties out there who are seeing creep from other peripheral
Mhm.
bodies and other parts of healthcare. How would you handle scope of practice issues in Florida?
Yeah, I mean, I think patient safety is the most important thing. So, while we need these like physician extenders so that we can create some efficiencies of practice, we have such a provider shortage and our population is growing. Those scopes of practice always have to be overseen by physicians. There should never be an increase of scope and practice that's not overseen by physicians so that we are creating opportunities for patients to get less or not as good care from their providers.
Awesome, awesome. Any other questions that you guys have for Susan?
I know that having gone to Tallahassee twice last year representing the Medical Society, that scope of practice creep is really, really strong. I was with Dr. Rebecca Bernard, who was trying to, fight that creep, and goodness gracious, there is a lot of resistance from the mid-level provider associations, if you will. How will that affect you? I mean, that was fierce, and I'm not even a physician.
Yeah. I mean, I think that understanding the process of like what you guys are going through and seeing that again, like patient safety is number one. Why should an optometrist that's only gone to school for 3 years be able to provide care that a physician, a medical doctor that's gone through internship, residency, and fellowship be able to treat patients with like surgically with lasers, all those things. And that's just the eye wars, which I happen to know a little bit about, but I know that that's happening in a lot of other specialties because we have like specialty shortages, we have provider shortages. And I really liked your question on the candidate questionnaire about expanding the residency opportunities in the state of Florida. The state is not making it easy for providers to come here or become medical practitioners here, and people are leaving our state. So creating opportunities for physicians to continue to learn here creates economically like more high skilled, better trained, higher paying jobs, but it also expands our opportunity to give our patients quality care.
Awesome. Well, thank you so much, Susan. I really appreciate it. Anything else you have for us?
I don't think so. Thank you guys for
Awesome.
your time. I know y'all are practicing all day and now you have to do this. So appreciate all
Well,
the
we're
time.
happy to. Thanks for joining
Thank
us.
you. Thank you for joining us.
Great, thank you.
Yeah, hello everybody. I am Dr. Cindy Banyai, candidate for Congress here in Southwest Florida, Florida District 78. So that encompasses basically everything that's called Fort Myers. So it's like Fort Myers City and then kind of like unincorporated Lee County, that's Fort Myers. And I am running for the House of Representatives this cycle. And I am here to represent the people of Fort Myers, the regular folks who are working to try to make a better life for themselves here in Fort Myers. And I hope to be their servant leader.
Awesome. Um, Tell us a little bit more about your background, if you don't mind. I see you have doctor in your name there. Tell us about that.
Yes, so I am an academic doctor, not a medical
Yeah,
doctor.
yeah. I'm
So
still very interested to hear it though.
Um, so my background is actually in politics. It's in political science and public administration. I have an undergraduate degree in international relations and psychology. I have a master's in public administration and international relations, and my master's is in actually Asia Pacific studies, but focusing on public administration. So I had worked in the international community doing international poverty alleviation for the early part of my career before I moved here to Southwest Florida. I spent 11 years on faculty at a local university here in Southwest Florida in the Department of Political Science and Public Administration, teaching global studies and international relations.
Awesome. Awesome. Well, our question for the candidates today we've been asking revolves around access to care issues. Now, commonly that discussion is for uninsured or underinsured, which is, very important for Florida residents. Tonight, specifically, I want to ask about insurance companies using their power to control access to care. As I'm sure you're familiar, um, thousands of times a day throughout the state of Florida, insurance companies are putting up roadblocks at prior authorizations, denials for procedures, surgeries, medical devices, imaging, all the above. Even when their doctors are, blatantly documenting that it's medically necessary. So, tell us, if you don't mind, a bit your thoughts on this topic, and then how you'd make change if you were elected.
Yeah, so we need to end this farce of prior authorization. I know that first and foremost in the state of Florida, we need to expand our Medicare access so that folks can get the access to the care that they need. And then we need to really do some work on how we can get everyday Floridians access to care. I am somebody who's been caught up in this particular system. My youngest daughter had a rare blood disease, and her treatment had no evidence-based treatment that was recommended. She had autoimmune hemolytic anemia, and she borrowed her oncology and hematology team borrowed from the sickle cell anemia research, and they recommended some immune suppression therapy, and that was actually denied by our insurance company. It was rolled into a medical bankruptcy that I actually ended up having to file after she had gotten that life-saving treatment. And there was a random doctor that was, sent to us months after she had actually gotten the treatment, that they denied the care. And it was a 3 years long battle before it ended up on my bankruptcy rolls, essentially. But it was the care that ended up actually saving her life. It was immune support therapy that saved her life, that ended the destruction of the hemoglobin in her body. And I 100% trusted her medical team. They were fantastic here at the Golisano Children's Hospital here in Southwest Florida. I have amazing interactions with those folks, and they did such a great job taking care of her. And the only problem that we ever had was with the insurance company either denying or delaying her care. And that has become a rallying call for me as I have run for office. And it was a bigger deal, I guess, when I was running for Congress, because there's a lot more that you can do at the federal level in terms of that, but it still stays with me as I run for office here in the state of Florida, because I think that no one in Florida should be going bankrupt to save their loved ones. And we shouldn't allow the profiteering in the insurance companies to override the care of medical practitioners.
Well said. Well said. I'm sorry I had to go through all that. Julie, do we have time for more questions, or how much time do we have?
Yeah. One more question.
Okay. I guess one more kind of going along the access to care pathway here, and just the physician workforce, and keeping enough physicians in Florida to allow the proper access to care. One of the big restrictions I know when I was looking to come here to Florida, and what other physicians do, has to do with the medical malpractice in our state. It's gotten a lot better from where it used to be 20 years ago, 20 plus years ago, but it's still not where it should be in our minds. What are your thoughts on this, and how would you affect change?
So first of all, I want to actually commend your organization for bringing this to the forefront. I know that insurance has been like a huge problem across the state, and I had heard some about this, but to understand the level of just how difficult it is for medical practitioners in the state was really highlighted by this organization as I was going through this process and reading what you had said. So I really appreciate that. Um, so first and foremost, I appreciate that we should work on making sure that medical malpractice insurance is affordable for our practitioners in the state, and that part of that comes with the ability to curtail the amount of money that is paid out to folks. So I am 100% on board with that. The other issue, of course, is with how we bring practitioners into the state, because I know that in our area, particularly here in Southwest Florida, we have a perennial gap in terms of our medical practitioners, everything from our specialists to our general practitioners. And it is absolutely due to part and parcel of our medical malpractice insurance, but it also has to do with how the entire economy here runs. We have trailing spouses and our school system that necessarily don't meet the needs of bringing those practitioners into our area. So when I look at making sure that we can bring those folks into our area, I also look at how we can make sure that we have the education system that is up to par, that we have reasonable insurance rates, and that we also have the education system and the community that fits bringing on that absolutely 100% needed specialists and practitioners into our area. So I want to just like pay homage to that. Like I am with you on the insurance issue, but I also see that there's a broader problem that we need to address to bring those practitioners into the area, and I want to make amends to that.
Awesome. Well put. Thank you so much.
Thank you. Thank you for all that you do. Like I said, I'm forever indebted to all of you for the work that you've done to save my daughter, and the work you do in our community. And I just appreciate you all so much. So thank you so much for this opportunity to speak with you.
So as you've obviously already stated, my name's Phil Carter, and I'm running for District 76 against Vanessa Oliver. My background, just to give you an idea of where I'm coming from real quickly, is high school to United States Air Force for 6 years, then to law enforcement. Then I went into business. I worked as a district manager for a chain called Goodrich Quality Theaters out of Michigan, overseeing 21 theaters in 5 states. I then moved to Florida. I got my real estate license because at the time things were really good and I had a lot of family down here. Upon getting my license, the economy collapsed. The real estate market collapsed. And I've been down here ever since. I've been down here for a while here in Florida, and I intend to live here until my days. I come from like I say, a law enforcement, Air Force, and business background. I got into this because I saw that we just weren't getting anywhere with the politicians that we have currently in office. And was certainly disgruntled like many others that have joined the ranks. So that's a little bit about me. I'm happy to answer any questions or tell you anything further about me, or take this anywhere you want to go with it.
Yeah, we appreciate that.
Mhm.
How long were you in law enforcement for?
I was only in law enforcement for a year or so after I got out of the Air Force. I
Okay,
did it for
awesome.
6 years in the Air Force, and it just wasn't what I wanted to do.
Yeah. Well, thank you for your service in the Air Force and in law enforcement. We appreciate that.
Absolutely.
Um, so, our question today is about access to care, more specifically with insurances limiting access to care of insured patients. Um, this is a hot topic, in the news, but especially for us physicians to spend hours every week in many cases battling prior authorizations, battling denials of things that are deemed medically necessary, scans, procedures, surgeries, medical devices, all these things, where insurance are putting themselves as the decision makers for medical care. They know that the more roadblocks they put up, the more likely the patient doesn't get the care, and the profits stay with the insurance company. So, if you don't mind, let me know your thoughts on this topic and how you'd affect change if you were elected.
Okay. So I just recently, I think it was about 2 weeks ago, gave a speech to a group here in North Fort Myers regarding what I term the insurance crisis, because the insurance crisis is a large envelope, as you're probably well aware. Um, there are solutions. My predominant thinking when I look at stuff like this, because I'm not a medical professional, I was pretty chagrined, and I got quite a lesson in the last. I ran a campaign previously against Ben Albritton for state senate, and I had doctors approach me and talk to me, especially when I made phone calls to talk to me about Roe versus Wade and the issues that are surrounding that. With regards to the insurance issue, though, there are a number of things that I think we can do. Um, I don't know that I have a specific, I should say, a specific solution right now. My objective once achieving office would be to certainly sit down with people such as yourself in the community and learn just where the pain points are, like you talked about with regards to the, having to go through the paperwork and trying to get things where they're supposed to be, and making it a hassle for the customer to be able to receive the insurance and just ended up giving up. Um, there are certainly things that we can do once in office to mitigate that. I'm not the guy typically that would run for office, is what I'm going to say. And I don't know if I can make this clear enough, but what I'm saying is I don't have an objective of getting in and expecting that I'm going to be able to fix every issue, or I'm going to be educated on every single issue that I'm going to be having to relate to. But I know that I will have people that I can reach out to, staff, and will be able to kind of address this very serious issue with the insurance crisis overall. But I don't want to sit here and try to waste a lot of time and state that I have some single solitary solution in my head right now, because I just don't. It's just something that would have to be, again, like I say, don't intend to be that politician that's in while the legislature is in and then just disappears. I'll be having town meetings and being involved with the people such as the doctors, the attorneys, the people that are involved in the issues that are affecting all the citizens throughout the constituency,
Yeah.
if this makes sense. I
No,
know this is not
absolutely.
a direct answer to your question, but I want to be honest. Like I say, I'm not a healthcare professional, and I don't want to try to profess to sound like I am, but I recognize the concern, and I recognize
Yeah.
the need for Congress, most certainly at the state level, to be active and involved in this.
Yeah, for sure. Well, I appreciate your willingness to listen, and it's a topic that's very important. And as you can imagine, myself just this week spending hours with patients, spending hours documentation, and then after all that, having to sit on the phone for hours with insurance companies, trying to convince them why a certain scan, for example, a patient just today with a large neck mass, we did a biopsy. The biopsy is inconclusive. The next step is a specialized scan called a PET scan to see if it lights up like a cancer would light up. Insurance denies it, right? And this is something that's absolutely necessary in the next step to avoid potentially a surgery that could cause complications or could seed cancer throughout the neck if we start digging around on the wrong type of cancer. So, long story short, you can imagine how that's scary for the patient, it's frustrating for the provider, and it's just not good healthcare. We are lucky to have such an advanced healthcare system in our country, and we should let the patients who are paying for their insurance have access to it,
I agree. And I will go further to say this, Doctor. I drove for about a year as I was retiring, because I just retired this last year. I drove for Uber, and a large number of the people that I would pick up would be people at hospitals or older people. So, and this was something that they talked about a lot. So, as I say, I know this is a hot topic. It's a very serious issue, and it saddens me. I mean, it really genuinely saddens me to hear some of the stories that I heard about some of the choices people had to make because either number one, they were in fear of what the process was, didn't think they had a chance in the process, or didn't think that their insurance was going to help them cover with the process. So, like I said, I don't want to pretend that I know all the answers today, but I can assure you it'll be a topic that I would put a lot of attention on.
Awesome. Very good. Julie, Stu, have anything else?
No.
All
One
right.
of the things I have noticed when I was up in Tallahassee a couple times last session, in the fact that the scope of practice creep was happening a lot, and there was a lot of bills last year that were making mid-level providers being able to. They wanted them to be able to do the same procedures that our MDs and DOs were doing. There's a lot of pressure from the big associations, the nursing association, the lawyers that are encouraging this growth, scope of practice. I know you're new or hope to be new to that practice. What's your thoughts on that, and who would you go to for that information to know if that was beneficial for the medical community?
Well, I guess right away, I'm a vet, so probably one of the first resources for me would be to go to the VA. They can provide me with a number of resources in regards to whatever issue that I might have. I guess that would be that's just where I would start. Can you repeat the question again for just the basic of the question for me, please?
Let me rephrase it. If there
Yeah.
is a bill on the table that requires something to do with physicians, who would you go to?
If I was going to, well, I would immediately probably go to, again, the VA as a resource to see where they would direct me. But I would go to doctors. I would want to hear from a doctor exactly what they have to say. I mean, that's the greatest source of information I could probably get.
Yes, and that's why we're having you here on part of the medical society, because we have 1,300 members in Lee County alone.
Oh, wow.
And you have a plethora. I mean, Dr. Botman and Dr. Casey, they're our legislative representatives, and so you've got two
Okay.
people right here you can come to and ask and say, hey, does this make sense that this procedure is being done by a nurse practitioner versus an MD or a DO?
Yeah, and I agree, and I would love to have that resource. Like I said, when I ran the first election, it was the second phone call I made to talk to people about getting money, and the second person I talked to was a 36-year nurse, and so she started questioning me about Roe versus Wade and where I stood on that. And of course, my belief was I was pretty minimally educated at that time on the overall subject, but my thought was women's health care should be in the hands of women and their doctor and their family, of course. What I learned from the nurses and doctors down the road was how wide this is, how much more it entails with regards to women's health. When we talk about pregnancy, I didn't realize, for me, I'm just going to be honest, I was ignorant. I thought a pregnancy termination was something that a woman did because she just decided, I don't want to have this kid, and there's just so much more to it. So again, having a resource like that would be beyond beneficial. And of course, I would reach out to that and you guys and try to figure out where I should stand on an issue.
Okay. Yep. Like I said, we have 1,300 members and we have physicians in every specialty. So
Awesome.
you have my cell phone now that you can use to say, hey, I need to talk to a psychologist, a ear, nose, and throat, radiology. You're meeting two of them here. So use us as a reference as well.
I will. Absolutely. And I appreciate that.
Yep. All right, guys. Is there any other questions?
Well, good. Thanks so much, Phil. Appreciate your time.
Thank you, gentlemen. I appreciate your time and I appreciate what you do. Nothing better than a doctor that keeps us healthy.
Yes, sir. Thank you so much.
Thank you, gentlemen. And you too. Thank you all so very much.